Hi, my name's Christian Henderson, and this is my presentation of the examination of two clinical processes at New York Kidney. So, my contact person was Lori Conlon, who works for New York Kidney, which is an offshoot of New York Health. New York Health is a healthcare facility that serves the greater New York area. The interview took place on the 28th of October, and Ms. Conlon walked me through two processes that they do on a daily basis. The first was the new patient registration process, and the second was the lab results and examination process. Of the two, the new patient registration process was simpler, while the examination process was quite a bit more complex. So the new patient process, the steps go as follows. A new patient calls to schedule an appointment. A packet of information is sent to the patient. Patient arrives at a facility. If the patient does not arrive at the facility, they must be called and rescheduled. If patient completed the informational packet, then they will proceed to the examination step. If patient didn't complete the packet, they must do the packet at that moment before they can be checked in. A receptionist creates a new electronic chart for a medical record and a medical record number. A patient is asked about prior visits and other medical history information. If a patient lets staff know the reason for the visit prior to the appointment, the entire process may go faster. The medical assistant takes patient's vitals and height and weight. Medical assistant takes patient to the exam room. The nurse practitioner or doctor conducts an examination process. If a prescription is required, it is filled out for the patient. Examination results are added to the patient's electronic health record. The patient is brought back to the front desk where they are billed, and if there is a copay, they'll pay it there, and then the patient leaves. The decision points of this process was: does the patient show up? Did the patient fill out the informational packet? Is a prescription required? Is there a copay? The informational needs are the patient ID, the insurance information, the contact information, and patient medical records, and any prior lab results. The roles involved are the receptionist, the medical assistant, doctor, nurse practitioner, registered nurse, lab employee, insurance provider, and patient. And some redundancies that could be fixed are: to save time and resources, a patient should have to complete the packet prior to being able to schedule an appointment, and this would help speed up the new patient process so they wouldn't have to do the packet there. This is the ISO 5807 diagram for the new patient process. It walks you through the steps as I did a moment ago. This is the You're Done diagram for the new patient process. And this, for the second process, which is the examination and lab results, these are the steps as follows. A patient has their height and weight recorded for a medical assistant. The patient is brought to one of the 10 exam rooms by the medical assistant. A patient is asked about their medical history. A nurse or physician examines the patient. If the patient needs lab work done, they are recommended to the lab at the facility, but the patient has the choice to go to an outside lab. If the lab results come back very abnormal, then the lab immediately calls the facility. The results are reviewed by a registered nurse and sometimes a doctor, and the results that need attention are forwarded to the doctor, who may have a registered nurse or nurse practitioner call the patient immediately to review the lab work with them. The person calling will ask the patient questions regarding the results, and if medication is needed, it will be ordered for them. The person calling may recommend that the test be stopped, the current medication be stopped, and the lab results being retaken. If results are abnormal but within the usual range, it'll be discussed next appointment. Patients may be instructed to go to the emergency room depending on the results. The facility may contact the emergency room in advance if the situation is bad enough. Depending on the results, the facility may give a referral to a specialist. Lab results are gone over with the patient at the next appointment. and any necessary prescription is made and the patient is released. So the decision points are: does the patient need lab work done? Does the patient want to choose what lab tests are done at? Are the results of the test very abnormal? Does the patient need to be alerted of the lab results immediately? Does the doctor recommend retaking the test? Is a prescription required? And does the patient need a follow-up appointment? The informational needs are patient ID, insurance information, contact information, patient medical records, any prior lab results, and the roles involved are receptionist, medical assistant, doctor, nurse practitioner, registered nurse, lab employee, insurance provider, and patient. A redundancy in the process is in when the lab calls the facility, the doctor or our registered nurse goes over the results, and the patient is called. This could be combined into a single step to eliminate the need to have the decision on to whether to call a patient or not if the results are bad enough. By combining into one step, if a lab feels the need to call the facility, then the doctors should feel the need to call the patient. This prevents, any patient who needs to be alerted but doesn't. That could prevent that from happening. This is the examination lab results ISO 5807 diagram, which walks you through the process as I did. This is the examination lab results you're done diagram. And so the recommended process improvements there are two processes that should be improved. They are: the patient arrives, checks in, and patient pays a copay. This could be combined into a singular step where the patient pays at when they arrive and checks in, pays the copay. This would make it less likely that a patient would leave before attending the appointment, which would waste the time and resources of the facility. And this would also save time by the receptionist not having to check the patient out at the end of the appointment. The second process that should be improved is the lab calls facility and the doctor goes over the results and the patient is called. This step allowed the facility to decide if they should call the patient to discuss the results or not. It should be changed so if the lab calls the facility to inform them of very abnormal results, then the doctor or registered nurse should have to contact the person to discuss the results. This would prevent the chance that a patient who should have been called wasn't. This is the process change matrix for the two processes. And this is the brand change matrix for the two processes. So a benefit of the action for the first process would be the patient pay. A benefit of the current process is the patient can change their mind and leave without already paying. What's a benefit for the patient? But a risk is it would be costing the facility time and resources. But by combining it reduces the likelihood of a patient leaving without attending the appointment and saves time. These are my references, and thank you for your time.